You don't have to live in pain anymore. This is the podcast where you'll learn the stories, tips, and tools to get back to your path to health. I'm Dr. J. Dudum. This is Back at It with Dr. Decompression.
Hey, this is Dr. Dudum with the Back at It with Dr. Decompression, episode 55, diving into pain, anxiety, and the weight that it plays on you and your family when you're dealing with a disc injury. This episode sparked by a call I got from a friend this week that's dealing with really severe back pain, really severe leg pain, sciatica to her foot. She can't exercise. She canceled Pilates. She canceled walking and exercising. She isn't sitting well. It's occupying her mind at work. She's not sleeping well, and she's just not herself. First question, what have you been doing, and what images did you get once we've got past the symptoms? She's seeing a chiro. They're doing adjustments, and they're doing decompression. I said, great. So what, are you getting better? No, the pain's getting worse. Okay. And the pain's getting worse and worse, and it's occupying my brain. Pain, okay, when you have pain mentally in the brain, it affects a few things. It affects your stress levels. It affects your anxiety. And in case you get a lot of fear, you get worried. It's not getting better. Is it something more catastrophic? Is it something that's going to affect me long-term with my family, long-term with my exercise or my career? Do I have to get surgery? Like something is wrong. And that's probably the case, but there's varying degrees of what's wrong. The point is, I know this feeling. I had this feeling 5 years ago when I had my back injury. So not only do I resonate with my friend that called me, but every single patient that walks in our door or that we talk to on the phone, I've had that problem. I've had the butt pain, the back pain, the leg pain. Walking with my family, I couldn't walk. I had so much fear and so much pain. It occupied my brain. And you wonder, how bad is this? And what the hell is going on with my back? And can it get better? Is this permanent? So pain occupies the brain. That's why you feel fear and you feel anxiety. Don't, okay? Don't succumb to the fear and the stress. You need to do three things to start that process to overcome it. It's easy for me to say, don't allow it to overcome you. That's easy to say. It's very hard to implement. So here are 3 steps you can do to start implementing that. Take action. You need to see someone. See a physical therapist, see a chiropractor, see an acupuncturist, call your medical. Start somewhere. Start a plan. So not only see someone, take action and see someone. Number 2, follow a plan. If you start with acupuncture, how many visits is it going to take? What expectation should I see? So start the plan. Don't see 20 people. Don't see 20 people and bounce back ideas. Feel confident with a plan and start a plan. You need to take action. And then number 3, have an expectation on results. For example, if you're seeing an acupuncturist, I'm just hypothetical here, and they say, hey, it's going to take 6 weeks to really feel 50% better. Okay. And if in 3 weeks you're 0 or you're worse, ask the acupuncturist, hey, are we still on track to get to 50%? You may not be, but what you want to know is that practitioner going to have a secondary plan and a tertiary plan? Are they going to have different steps? Not just a one size fits all, hey, we're going to try this and see what happens. So relating back to my friend, she's been there for 4 weeks, getting worse. Okay. And I said, okay, do you have any imaging? She has an x-ray. She has degenerative disc disease at L5-S1, the lowest part of the spine. Okay. What does your MRI say? I don't have an MRI. Okay. She asks, what would you do on the table differently? What would you do? Well, she's getting pulled flat and she's not getting better. So I said, you need to get an MRI because the MRI is going to tell me, is it as I've said many times on this show, is it a disc bulge? Is it a herniation? Or is it an extrusion? So we have to classify the type of disc injury. Number two, we have to classify not necessarily the level of the disc injury. You can base that based on symptoms. So for example, if it's a butt spasm or a butt pain, it's probably 4-5 or 5-1. If it's more the anterior or the front of your thigh, like your quad, it's going to be higher up in the lumbar spine, like 2-3 or 3-4. But if it's down the back of the leg and the butt, it's lower. You can get an idea of where these disc problems are in the spine. It's not what I'm talking about. I'm talking about the type, like a herniation, bulge, or extrusion, and I'm talking about the migration pattern of that disc material. So I want to know, is that herniation posterior? Sorry, is it central? Is it paracentral to the side a little bit, or is it posterior lateral? Well, it's all the way on the side. And if it's not a herniation, is it an extrusion? I was going through this with one of our doctors yesterday on a patient, and they had a extrusion that had gone caudal or down. I talk about this many times, meaning this disc has migrated down south and below. If that's the case, that greatly changes the angle of my table versus if the extrusion has gone cranial or up this way, up that way, towards the head. If it's towards the head, I'm going to really flex the table. If it's towards the tail, I'm going to flatten the table. So my next move for my friend would be, if it's a herniation, I might go up, or if it's a posterior lateral herniation, I might flip them over on their stomach. I need to know what's causing the problem. Yes, it's probably a disc injury, but how is it causing the problem? How is the disc presenting? So I said, you need to get an MRI. And then I would ask the practitioner, it's not working. That doesn't mean it's not going to work. It's not going to work if we don't do something different, right? You have to do something different. So, hey, what are we going to do different because I'm not getting better? And if the doctor says time, well, maybe, but personally, I find that hard to believe. You want to hear is, hey, if you're not responding to this, we're going to do this. Okay. And what if I don't respond to that? What would we do? Oh, if you don't respond to that, we're going to do this because of that. You want a practitioner and a program that has not a cookie cutter, but can modify the treatment based on your symptoms, the objective measures like your MRI, but also have a fallback plan, because not everyone responds the same to every program. And she says, well, again, this is my friend, how do you know that, are you sure I have a disc injury? I ask 3 simple questions that confirm she had a disc injury. Number 1, can you put your sock and shoe on, or does your right butt and leg pain hurt? The answer was yes. Number 2, when you sit, does it bother you sitting for more than a long period of time? Yeah, sitting sucks. Okay. And does walking make it feel better? Yeah, when I walk, it feels better. And I said, number 3, does coughing make it worse? Like, can you cough right now? Oh my gosh. Yeah, that caused a lot of pain. I said, you have a disc herniation. Those are classic disc herniation signs that's referring pain down your leg. She's pushing to get an MRI with Kaiser. She's not having any luck because most medical systems aren't just going to get an MRI. You've got to go through 4 to 6 weeks or 8 weeks of conventional wisdom or conventional treatment and fail before you get an imaging, because they have to pay for it. So a lot of times you have to go outside of these medical systems because they're not designed to get you better faster. You're designed to go through their systems and their protocols. So when it comes to decompression, how are we going to do this? There's different angles we can do. right? Up and down. There's different oscillation cycles we can do, and there's different amount of weight we can do. All these are based on the MRI, and you have to be able to try different things, which is what I told her to do. But the main theme of this is, she's never dealt with severe pain like this, and she is scared and she's nervous. Just like I was 5 years ago. I was terrified because you start thinking about catastrophic things and you think that something's really wrong because of the amount of pain you're in. Especially when you try one thing and you make that step and you try and you call someone and you go through a 4-week program and you're not seeing much change, if any. Just make sure that practitioner has a way to adapt the treatment. It's not a cookie cutter. It's not a one size fits all. And number 2, keep taking action, keep asking questions, and get objective information like imaging that can calm your anxiety down. You need to start breathing, start walking, and just stay positive, and it's going to get better. You have to take action and stick with the program. That's the main message today. Take action, follow a program, and if it's not working, because it doesn't always work, if it's not working, ask the practitioner, how are we going to modify this program? And if not, there's no modifications, you may want to switch practitioners. It'll be okay. Just take action. That's the episode. I want you to take action. If you're listening to this and you're dealing with pain, I get these questions all the time on all our platforms. Patients that are suffering, asking for advice. Hey, I've got a neurosurgeon appointment in 3 weeks. I'm in severe pain. What should I do? You shouldn't wait 3 weeks. Have you tried decompression? I'll help you find someone. Try decompression. You have an appointment in 3 weeks. Take action. Otherwise, you're just sitting there for 3 weeks. So take action.
It's obvious that you're having lower back pain and you want to get relief. Text me the word relief to 925-291-5670 to download your free low back pain guide. Start fixing your back today and get the relief that you deserve.
Hey, if you like this kind of material regarding low back, disc injury, sciatica, and how to avoid injections, medications, and surgery, subscribe to the channel. That's what I talk about every day. Comment if you want me to talk about something different or have a specific question. I'd love to answer that in our next podcast. Actually, I'm going to do that. Next podcast, number 56, whoever comments the best comment, I will have that be the theme for episode 56. So thanks to our sponsors, Pillowise USA and PowerPlate. I'm Dr. Dudum. This is the Back at It with Dr. Decompression. Thanks for listening.